Hi, I'm Yan Han, a co-founder of NuPoint. Before I begin, let's talk about strokes. Strokes are caused by improper blood flow to the brain, and that results in a whole host of long-term issues, not least being the loss of physical mobility in one half of the body. And when one suffers a stroke, they go through something called occupational therapy. It's a process where one receives treatment, medication, and support to regain the ability to perform meaningful tasks so they can return to society. The issue is that in today's occupational therapy processes, therapists have to rely on making crude observations and asking very simple questions to determine recovery progress, and that's not very accurate. And with that, they then prescribe exercises to do at home, which are not the most effective or comfortable. And when the patient goes home and does exercise which don't feel like and almost certainly are not doing anything, by day 3, you lose motivation. And motivation is a massive factor to recovery. And then they go back to the therapist, and the cycle continues and repeats and repeats. And after 6 months, the golden period of stroke recovery progress plateaus. And for this entirely preventable reason, in Singapore, 10,000 people suffer a stroke every year. And of these 10,000, 6,000 will never fully recover. And so then we ask ourselves, what can we do? Well, we have built NuPoint, a wrist-mounted wearable that can track metrics relevant to stroke recovery anytime, anywhere. With this, we seek to increase the accuracy of diagnosis, and number 2, we also want to reduce the overall number of visits to the therapist. And we do this via 2 main suites. With our unique sensor suite, we collect data, pass it through a model, and then 1, we give it to the therapist so they can plan treatment better, and 2, we give it to the patient in a form of tangible positive feedback so that they can support their motivation. Now, how can we do this? Well, there's something that we call a 5-finger spacing. With our sensor suite, not only can we track the movement of space of the arm, we can also track finger movements. And in stroke recovery, the fingers are more than half the battle. And this means that not are we the only ones in the market that can track fingers, we can also provide additional support in therapy in general and also telehealth. Well, we want to validate with the entire chain, from institutional staff to the therapists, to the patients, to the caregivers. And this is important because as long as a single one of these people do not agree, adherence becomes difficult. And in fact, we have onboarded 2 partners to support us in that we want to work together for this journey. We have the Stroke Support Station and the Singapore National Stroke Association. With both, we are innovation and ecosystem partners where we perform user trials, interviews, engagement, and community involvement very regularly. And they will be our first customers moving forward. In pursuit of this goal, we seek to resolve SDGs 3 and 10. And we should do so because we want to lower barriers of treatment. We want to support mental health and motivation. We want to reduce the financial burden on those, especially those whose income has been affected by stroke itself. And last but not least, we want to help them return to society and feel like a working member again. Our business model is very simple. We sell the band to the clinics and service providers for $2,000 per band, and then we sell the software as well for them for $50 a month. The bands are then prescribed to the patients at no cost, and believe it or not, this actually saves money for the institution. Our timeline is also simple. We have completed our first prototype and we have conducted our first user trials, and we seek to do more of that this year. And by quarter 2 of 2026, we want to have our first beta release so they can actually get into the therapy process and help people for real. And for that, we have a very powerful team. Myself, Yan Han, and David are both serial founders. We have worked in technical and business roles in the past in the student life. And we have Ian, Gangesh, and Darren, who are all capable in their respective fields in technical and business. And with that, thank you very much. And please support NuPoint.